age ranges. And there is no type of person who succumbs to opioid addiction. And so the historic settlement that was signed in 2021 signaled accountability for the partners responsible after years of opioids devastating our communities and taking too many lives too soon. And so I'm proud to be signing a bill that will put millions of settlement dollars to work right away, funding projects that will help save lives and mitigate continued suffering for residents as well as their loved ones. Milwaukee County has been on the front lines of this battle, pursuing relief through the court system for years. And today we're taking the next step in unlocking desperately needed funds for Milwaukee County to specifically address the destruction left by the opioid epidemic. And by following the data and investing in the communities with the highest need, we are optimistic that these settlement fund dollars will make a sizable impact in addressing behavioral health all across Milwaukee County. And I want to say thank you to the Chairwoman Marcelia Nicholson and the entire Milwaukee County Board for their partnership in addressing the opioid crisis that has been facing our community. And so I want to say also thank you to the county department leaders who are helping to execute the 15 projects that are going to be funded with these settlement dollars. And so I'm going to sign the bill right now. There you have it. And so I'm going to ask that Supervisor Cox Jones take the podium and say a few remarks.
Good morning, ladies and gentlemen. As County Executive Crowley stated, I am 13th District Milwaukee County Supervisor Priscilla E. Cox Jones. Milwaukee County is taking a proactive approach to addressing the opiate epidemic and other drug-related health issues by introducing the harm reduction vending machine. I am honored to be a part of this announcement and elated to inform the public that the first machine will be in the Cox Center, making it easily accessible to those in need. And I would like to applaud the approach as it truly maximizes the effectiveness of our funds. The Cox Center is a fitting location for the first harm reduction machine in Milwaukee County. The center is named after my grandmother, Marsha Priscilla Cox, a civil rights leader, the first African-American woman elected to the Wisconsin State Assembly, and who is also remembered by this quote: "We cannot legislate the hearts, but we can legislate the laws." Given her legacy and fighting for social justice and equality, I'd like to think she'll be extremely proud of the work done here today. Supporting harm reduction initiatives is in line with her legacy of advocating for marginalized communities. Next, I would like to state that the harm reduction vending machines does not condone drug use. Rather, they recognize the reality that many people will continue to use drugs regardless of the legality of the risk involved. By providing access to harm reduction supplies, these machines will help keep individuals safe and reduce the spread of disease like HIV and hepatitis C. The introduction of the harm reduction machines in Milwaukee County is a positive step to addressing the root cause of drug addiction and overdose. This in turn will improve the overall health and the well-being of Milwaukee County and our community. Now, to someone who knows all about community and health, Dr. Ben Weston.
Good morning. Good morning. And thank you, Supervisor Cox Jones. This is a big step for our county and for our residents. We're seeing a record-setting epidemic. In Milwaukee County, someone dies of an opioid overdose every 16 hours. And these people are young. The average age is 44 years old. They're men and women. They're black and white, Hispanic, every race and ethnicity. They're also sons and daughters, fathers and mothers. In my other role as EMS medical director, occasionally I get out in the field. And a few weeks ago, I was out with the Milwaukee Fire Department. A call came in for a woman who had overdosed. We went to her home. We found her laid out between the kitchen and the living room after an overdose. She was in cardiac arrest. And they jumped in, they did CPR, they tried to resuscitate her, but as is far too often the case, they were unsuccessful. We were unsuccessful. And after declaring her death, I walked outside and there was a police car parked out front. And in the passenger seat of the police car was her daughter. She was no more than 6 or 7 years old. And sitting next to her was another young police officer trying his best to engage and distract her on what would undoubtedly be one of the worst days of her life. This happens every day in Milwaukee County, every 16 hours. Now, while these deaths years ago were due to heroin, that's now but a trickle. Fentanyl has become the drug of choice, accounting for a staggering 95% of opioid overdoses. And while we can and are working upstream to prevent these overdoses before they occur, so too is it important to work on harm reduction, minimizing the adverse effects of opioid use in our county. This infusion of opioid settlement dollars will allow us, under the progressive leadership of County Executive Crowley, to expand existing efforts and add new interventions to prevent the worst outcomes from opioids as we connect folks with resources in our county. The 15 funded projects from the Department of Health and Human Services, the Office of Emergency Management, the Medical Examiner, and the Sheriff will target the most vulnerable members of our community, providing them the opportunity to first survive, and second, to recover from opioid use disorder. These harm reduction vending machines are a new and novel means to distribute the essentials of harm reduction. The naloxone nasal spray, an instant reversal agent for opioid overdoses. And fentanyl test strips to warn users if the drug they're about to take may be stronger than they anticipate, allowing them to adjust their behavior. And more supplies that Jeremy will talk about shortly. As with other initiatives in Milwaukee County, this will be data-informed and transparent, in part using the Overdose Dashboard, a partnership between Milwaukee County and the Medical College of Wisconsin. For both the placement of these vending machines and the evaluation of their impact, transparency and data will help us to move forward as a community and become healthier as a county. Thank you, and I'm honored to hand off to Executive Director of DHHS, under whose steadfast leadership these vending machines became a reality, Shakita LeGrand.
Thank you, Dr. Weston, and thank you all for joining us. The opioid settlement funds would allow Department of Health and Human Services, Behavioral Health Services to expand our partnerships and evidence-based practices to invest in harm reduction and increase efforts around prevention for all Milwaukee County residents. Department of Health and Human Services is implementing 7 projects to address the opioid crisis throughout the populations we serve, including older adults, those struggling with homelessness, and individuals in our care and custody. Through our coordination of Opioid Prevention Services Project, we are granting settlement funds to community-based organizations to increase our capacity and expand our efforts already proven to be effective. Recently, we hosted community conversations, inviting all members of the community to share their thoughts on how settlement funds should be invested. We had a great turnout, and we walked away with many ideas, new ideas. In April, we will release a request for proposal seeking community partners in our prevention and harm reduction work. And currently, we are seeking partners to host one of these machines that Jeremy will talk about soon in the next moment. So over the past several years, the Behavioral Health Services team has developed a number of successful evidence-based practices in collaboration with community partner agencies, such as medication assistance treatment, Outpatient Plus, and bridge housing. The more we collectively work together to reduce harm, the more we can save lives and create healthy communities together. With that, I'll turn it over to Jeremy Triblett, our prevention coordinator.
Thank you, and thank you all for being here. It's my job to introduce you all to the vending machines, but before we do that, I really want to give a thank you to the partners that allowed us to really pull this all together. We partner with HRI Vending to actually supply the vending machines. We've purchased a number of them from them, and we want to thank them because they have been an absolute engaged and passionate partner on behalf of this. The second partner we want to mention is LifePoint as well. Vivint LifePoint is the partner who actually will hire one person to manage all of the vending machines across the county. So we're making sure we're putting person power behind this project as well. So we want to thank them for being a longtime contributor to harm reduction and prevention in our community as well. The next thing I want to do is mention community partners who we are looking for actively. The application to get this vending machine is on the betterwaystocope.org website. If you press betterwaystocope.org, you can find the application there. Okay, we already have 15 organizations who have decided that they want a vending machine, and we are looking for more. People always ask us the question, who do you want to have a vending machine? We say we want anybody with an organization in community who is committed to this work to apply to get a vending machine. That includes libraries. That includes churches. That includes restaurants. The process that we're going to take is after you complete your application, we're going to gather them and we're going to interview all of the agencies, walk through the organizations, and prepare them to make sure they understand what it means to have a vending machine. The second requirement that I want to mention is that each agency who signs on to have a vending machine should also represent a community partner as well. Be willing, able, and capable, enthusiastic to go out and educate our community on everything in the machine. This is not a trophy item. This is an item, a container to help save lives, okay? And so I'll talk to you all about what's in the machine currently. We have nasal Narcan, which Dr. Weston mentioned already. We also have medication lock bags. There are a lot of residents in Milwaukee County who actually have medications that they need to keep safe. Keep out of the hands of someone who is not prescribed that medication. We provide these lock bags. You can use a key, and there is a 3-part code you can use as well. Put all your medications in there, put it in your nightstand. It decreases the likelihood that somebody who was not prescribed your medications will not take your medications. The next piece is the deterrent deactivation bags. Folks get really excited when we talk about these because they are a great way to dispose of unwanted medications. We're talking about pills and or liquids that you can put in the bag, add water, shake it up, and put it in your garbage can. It's a great way to save the environment and make sure you are disposing medication that you don't want to keep around. We also have fentanyl test strips, which Dr. Weston definitely spoke to as well, and we have gun locks in the vending machines as well. When we talk about gun locks, it's going to be critical for us to make sure we can prevent residential trauma due to gunfire as well. And so we put those in these vending machines. The last thing I want to mention is that for community partners who would like a vending machine, when you go to betterwaystocope.org and complete your application, understand that everything in this vending machine is free to the public. You are to educate the public, your surrounding community, and every staff person in the agency will get access to training on all of these supplies free to the agency. We want to make sure we're always training the people who will be having the vending machine, and we're going to put together educational events where we can educate the residents around the agencies that host the vending machine as well. So we're excited. We already have 14 or 15 applications. We want to make sure we increase those applications, and we also want to make sure that the entire county understands that we want a vending machine in all 19 municipalities. We are wanting that in all across the county. We want to make sure you feel included to do so and enthusiastic to get started. All right. Say it again. Does anyone have any questions?
How did the county come up with the idea for the vending machines
Thank you for that question. So SAMHSA already talks about, there's a report that talks about when you empower folks with the supplies to actually do harm reduction, you decrease the likelihood that folks will actually overdose, right? So we understand if we put these things in folks' hands, they have a greater chance of saving someone else's life. So that's critically important. That's really the seed of this entire project, right? We also know that we are not the first city in the state, nor are we the first state to actually implement harm reduction via vending machines. The truth is these are items we traditionally used to hand out hand to hand, person to person. Now we found another mechanism using a familiar device, a vending machine, putting it in places that I can't be because I can't be in two places at once, and allowing folks to increase that access. The other thing we did was we incorporated posters that you're going to see here. You're going to see posters here. Every agency who hosts a vending machine will get a poster as well and handouts that you can have. All of these posters and handouts tell every person exactly how they can use each one of these items as well. This is a 3-year project, right? So we're starting off with handouts and posters, but we're also watching the project very closely. We're analyzing data because we want to improve the project. If we can incorporate more technology, we're willing to do that as well. Thank you for your question.
You mentioned these are free to the agencies. Are they free to the public as well? And is there a limit on how many items one can get at a time?
Yes, very familiar question.
Can we get you behind the podium as well for?
Oh, sorry. Thank you. So this is free to the agencies, and all of the items are free to the community. This is a free project. The second question you asked was how many people can take. We encourage people to take as much as they need. We've got questions around what if people take too many, or what if they empty out the machines. We'd rather focus on implementing the strategy and making sure we can implement something that works, so we'll take our time. We won't hold back on helping to save a life because somebody may have a concern about taking too much. Any other questions?
I know this is funded through the settlement. Is there any worry, concern that funds might run out for this? Maybe at the end of the 3 years or even this year possibly, or is that not a concern?
We don't have that concern at the moment. Thank you.
You mentioned that there's already kind of demand for the vending machines among some community partners. Are there any particular areas where municipalities in the county that have like really high demand?
I love that question.
Like right now?
Yeah, so we're working with our data teams to actually identify. We've already identified that there's about 7 zip codes that do have a higher amount per person, per 100,000, I believe it is, of incidents. One of the things that we're very intentional about is that this does reach the entire county, right? And so we want to make sure all 19 municipalities have a vending machine. We're also very clear about that we may need to put more vending machines in certain locations than maybe others. Go ahead.
Are you able to give us like a demonstration of like how it works?
Well, that's the #1 question now, isn't it? We'd actually like for someone else to vend besides me. Do I have a volunteer? Go ahead.
Usually behind the camera, right?
Yeah. Okay, so what do I gotta do?
So the vending machine is free.
Okay.
You would look at the numbers below each of the items, and you would choose a letter and a number, press that into the machine, and it should drop out for you.
Doesn't matter which one I.
You can choose whatever you like.
A lot of pressure.
Thank you.
Yeah, thank you.
How many of these vending machines will there be in Milwaukee County once this is fully in place?
Beautiful question. The first year we plan to disseminate 11 machines. The reason why is because we want to make sure we're actually disseminating them and creating a process for inventory, communicating with agencies, and educating the community. We've purchased a total of 25. Go ahead.
Are there any other harm reduction strategies or innovations that the county is considering in the near future?
There are a lot of innovations we're considering. We're always considering those. Currently, we funded 15 projects with the settlement dollars. All of those really sustain a lot of those powerful innovations we've already made, but we're always on the horizon of something new and something different. Thank you. Go ahead.
Are there any machines targeted to the college areas? I know opioid and drug overdose tends to happen to younger teens and stuff like that too.
Yeah, the short answer to that question is we are targeting all spaces and places with all demographics. If they want to apply, they can. It could be a university, a college, anything like that. The long answer is that we want to make sure once we get our first batch of applications in, if there is a specific demographic, location, or business type that hasn't applied, we can look at that and go, well, maybe we should create a specific campaign around college students, for example. So we're always looking to improve this project and innovate in all the ways we need to. Go ahead.
Do you foresee this project heading in the direction of providing safer use supplies?
Yes, we do. When we talk about safer use supplies, that's going to be a critical piece. There's a lot of evidence and research that says that people's lives definitely are safe when they have a safer use mechanism. Those are conversations we're always having, and we're not afraid to innovate in that direction as well.
Last question, one more.
All right, thank you all for your questions.
Well, thank you.
If anybody wants harm reduction supplies, you can come and vend them at this time.